Last year, I opened the chest of a 72-year-old woman named Margaret, whose arteries looked like rusted iron pipes. Yellow, brittle, stiff. She was on 3 blood pressure medications. 3. And her pressure was still dangerously high. She was a retired nurse. She wasn't lazy. She wasn't ignoring her health. She was doing everything her cardiologist told her to do. And yet, there she was on my table. But here's what nobody told her. And what I'm going to tell you today. The answer was already sitting in her refrigerator the whole time. 5 simple things. No new prescriptions. No strange routines. Just food. Working the way food was always meant to work. Stay with me because by the end of this video, you're going to know exactly what to do, starting tonight. Let me tell you something they don't always explain at the doctor's office. After 60, your blood pressure doesn't just go up because of stress or salt. Something deeper is happening inside your arteries. Think of your blood vessels like a garden hose. When you're young, that hose is flexible. It stretches, it absorbs pressure, it handles the flow. But as you age, the walls of those vessels begin to stiffen. They lose their elasticity. And a rigid hose cannot handle the same pressure a flexible one can. That is when things start to go wrong. Now, here is what makes this personal for me. I am Dr. Sofia, and I have spent over 25 years as a cardiac surgeon. I have held human hearts in my hands. I have repaired arteries that looked like they belonged in someone 20 years older. And every single time, I ask myself the same question: how did it get this far? The answer more often than not is inflammation. Chronic, silent, slow-burning inflammation in the walls of the blood vessels. You do not feel it. There is no obvious symptom. But day after day, year after year, it quietly stiffens and narrows those vessels. And your heart has to work harder and harder just to push blood through your body. So why does food matter so much? Because what you eat 3 times a day is either fighting that inflammation or feeding it. Every meal is a decision your body makes about your blood pressure. Most people do not realize this. Their doctors do not always have the time to explain it. That is what this video is about. Not replacing your medication. I want to be very clear about that. But giving your body 5 powerful tools that work alongside whatever your doctor has prescribed. Tools that, in many cases, I have seen make a dramatic difference. Sometimes within days. Are you ready? Let's begin. Beets. That is where we start. If you have never eaten a roasted beet in your adult life, today's the day. 1 cup a day. Either roasted, boiled, or juiced. I can already hear the hesitation. Beets are strange. They stain your cutting board. They taste like dirt, I understand. But here is what happens inside your body within hours of eating them. Beets are one of the richest dietary sources of dietary nitrates. Your body converts those nitrates into nitric oxide. And nitric oxide, I mentioned this word earlier, is your body's natural vasodilator. It is a chemical messenger that tells your arteries to relax, open up, and let the blood flow. In a study published in the journal Hypertension, drinking just 1 cup of beetroot juice lowered systolic blood pressure by an average of 8 points within 24 hours. 8 points. That is clinically significant. That is the kind of number that changes a medication conversation. But here is the part most people miss. That nitric oxide boost is not permanent. It is a daily medication from the earth. It works, then it fades. Which means consistency is everything. 1 cup of roasted beets with lunch, or 4 ounces of beet juice in the morning. Choose the form you will actually eat. That is what matters. I had a patient, a retired engineer, 68 years old, who started drinking 1 small glass of beet juice every morning before his walk. Within 3 weeks, his home readings had dropped nearly 10 points. He said it felt like his chest was breathing again. He was not wrong. Have you ever tried beets as an adult? I would love to know what you think of them. Drop it in the comments. Now, let us talk about something you probably already have in your kitchen. Garlic. 1 to 2 raw cloves a day, crushed and left to sit for 10 minutes before eating. Yes, raw. I know. Stay with me. Garlic contains a compound called allicin. Allicin is released when you crush or chop a clove, but only after it has had a few minutes to react with the air. That 10-minute pause is not optional. It is the entire mechanism. Once formed, allicin does something remarkable in your blood vessels. It stimulates the production of hydrogen sulfide, a gas your body uses to relax smooth muscle in your artery walls. At the same time, allicin acts as a natural ACE inhibitor. You may have heard of ACE inhibitors. They are among the most prescribed blood pressure drugs in the world. Garlic does the same thing, gently, from your kitchen counter. A meta-analysis in the journal BMC Cardiovascular Disorders reviewed 20 different studies and found that garlic supplementation reduced systolic pressure by an average of 5 to 8 points. That is not a small number. One of my patients, a 74-year-old grandfather, started eating one crushed raw garlic clove mixed into his Wufan every day. He called it his morning shot. His cardiologist reduced his medication dose at his next visit. He cried in my office. He said it had been 12 years since a doctor had lowered anything. Now, a few practical notes. If raw garlic is too intense for you, roasted garlic still has benefits, just milder. Aged garlic extract supplements are also well-researched. And one important caution, if you are already on blood thinners like warfarin, talk to your doctor before adding large amounts of garlic, because both thin the blood and the combination can push too far. But for most people over 60, one clove a day, crushed, rested, eaten, is one of the most powerful tools on this list. Let me ask you something. Do you check your blood pressure in the morning? Most people do. But here is what almost nobody talks about. What happens to your blood pressure while you sleep? For many people over 60, pressure does not drop the way it should during the night. It should go down. It should give your heart a rest. But in a condition called nocturnal hypertension, it stays high or it spikes. While you are lying there completely unaware, your heart is working overtime. Your arteries are under stress. You wake up the next morning feeling tired and wondering why. So, what does wild salmon have to do with any of this? Quite a lot, actually. 4 ounces of wild-caught salmon, 3 times a week, eaten at dinner. And here is why. Wild salmon is one of the richest sources of long-chain omega-3 fatty acids, specifically EPA and DHA. These are not the same as the omega-3s in flax or chia. These are the active, anti-inflammatory forms your blood vessels use directly. EPA and DHA do 2 important things. First, they compete with the inflammatory omega-6 fats that crowd your cell membranes. They push the door open for healing. Second, they increase the production of resolvins and protectins, which are compounds your body literally uses to shut down inflammation in your vessel walls. Think of it this way. Every meal you eat without omega-3s is a meal that is letting inflammation continue its slow work. Every dinner with wild salmon is a meal that is actively telling your body to stand down. I had a patient, a 69-year-old violinist, who could not tolerate statins and did not want to. She added wild salmon 3 times a week to her routine. 6 months later, her inflammatory marker CRP had dropped by 40%. Her cardiologist said it was the lowest he had ever seen in her chart. She said she felt sharper, lighter, and her pressure was finally stable. Farmed salmon is fine if that is what is available and affordable. Sardines and mackerel work just as well. And if you cannot do fish, a high-quality fish oil supplement with at least 1 gram of combined EPA and DHA is a reasonable backup. But real fish, 3 times a week, is the gold standard. Now I want to tell you about something most people think of as a treat: dark chocolate. Yes, the kind with 85% cocoa or higher. 1 small square, about 20 grams, every day. If that sounds like indulgence, let me show you the science. Dark chocolate is packed with compounds called flavonols. And these flavonols do something very specific inside your blood vessels. They stimulate the lining of your arteries, called the endothelium, to produce nitric oxide. We have talked about nitric oxide before. It is the same molecule beets give you, the molecule that tells your arteries to relax and open. A study from the journal Heart found that participants who ate a small square of dark chocolate every day for 2 years had lower blood pressure, fewer heart attacks, and fewer strokes than the control group. Every single day. A small square. Researchers in the study called it the smallest prescription they had ever seen. One of my patients, a 76-year-old poet, started eating 1 square of 90% dark chocolate after dinner as her evening ritual. Not only did her readings improve, she said it gave her a reason to slow down and breathe. The ritual itself calmed her. The ritual matters. One important note. We are not talking about milk chocolate. We are not talking about chocolate bars loaded with sugar and caramel. Those will work against everything else we are doing here. We need 85% or higher. Bitter, real, small. 1 square a day. If you cannot tolerate bitter chocolate, start at 70% and work your way up. What is your chocolate of choice right now? Tell me in the comments. Finally, I want you to walk to your kitchen after this video and open your freezer. Because what I am about to tell you might be the most underrated food on this entire list. Frozen wild blueberries. 1 cup a day. They do not have to be fresh. They do not have to be expensive. The frozen ones, in fact, are usually more nutritious because they are frozen at peak ripeness within hours of picking. Blueberries are one of the richest sources of anthocyanins. That is the same family of compounds we talked about with hibiscus tea. Anthocyanins cross the blood-brain barrier, they cross into your blood vessel walls, and once there, they do 3 things. They reduce oxidative stress, they improve endothelial function, they lower the production of inflammatory cytokines. In plain language, they soften your arteries from the inside. A large study that followed over 93,000 women and men for nearly 15 years found that those who ate the most blueberries and strawberries had a significantly lower risk of heart attack. Researchers specifically pointed to anthocyanins as the active ingredient. I had a patient, a 65-year-old piano teacher, who sprinkled 1 cup of frozen blueberries over her morning oatmeal, every single day, no exceptions. 3 months later, her systolic pressure was down by 9 points. She had also lost 10 pounds without trying. The berries had quietly rebalanced her entire metabolic profile. A small note: if you are on blood thinners, particularly warfarin, blueberries can interact. Keep portions moderate and tell your doctor. But for most people over 60, 1 cup a day of wild blueberries is one of the safest, most pleasant additions you can make to your routine. I want to stop here for a second because I think something important needs to be said. You have just heard 5 things: beets, garlic, wild salmon, dark chocolate, frozen blueberries. And I can already predict what some of you are thinking right now. This sounds too simple. If it really worked, my doctor would have told me. I understand that reaction completely. I had it myself early in my career, but here is what 25 years of opening chests and repairing damaged hearts has taught me. The most powerful interventions are almost never the most complicated ones. The body is not looking for complexity, it is looking for the right conditions to heal itself. And here is what genuinely shocks me even now. Every single one of these 5 strategies works through the same fundamental mechanism: reducing inflammation and improving blood vessel flexibility. That is it. That is the whole game. 5 different doors, all leading to the same room. The woman I told you about at the beginning, Margaret, the 72-year-old with the rusted iron arteries. After her surgery, I sat with her and her daughter for a long time. We talked about all of this. Every one of these 5 things. She made every change slowly, carefully, in conversation with her cardiologist. 6 months later, she came back for her follow-up. Her doctor had reduced her from 3 medications to 1. Her inflammatory markers had dropped significantly. Her pressure was stable, genuinely stable, for the first time in years. She looked 10 years younger, and the first thing she said to me when she walked in was this: "Why did no one tell me this sooner?" That question stays with me. It is part of why I make videos like this one, because the information exists. The research exists, but somewhere between the laboratory and the doctor's office and the patient sitting at their kitchen table, it gets lost. You are sitting at that kitchen table right now, and you have everything you need to start tonight. Not tomorrow, not after your next appointment. Tonight. That is not a small thing. That is everything. Let's bring this all together because I do not want you to leave this video with a list you will forget by tomorrow. 5 things, 5 changes. Let me say them one more time clearly. 1. 1 cup of beets a day, roasted, boiled, or juiced. 2. 1 to 2 raw cloves of garlic every day, crushed and rested for 10 minutes before eating. 3. 4 ounces of wild salmon 3 times a week, at dinner. 4. 1 small square of 85% dark chocolate every day. 5. 1 cup of frozen wild blueberries every day, sprinkled over anything you like. That is it. 5 things. No exotic supplements, no expensive equipment, Nothing that requires a prescription. Now, here is what I want you to do right now, before you close this video. Pick just one. Not all 5. Just one that feels easiest for you tonight. Maybe it is the beet juice in the morning. Maybe it is the garlic you already have in your kitchen. Maybe it is the small square of dark chocolate after dinner. Just one. Start there. Because sustainable change does not come from doing everything at once and burning out in a week. It comes from one small decision. Repeat it consistently until it becomes invisible. Until it is just the way you live. I have seen this work. Not in theory, in real people. In their 60s and 70s and 80s, who decided it was not too late to give their body better tools. It is never too late. Your blood vessels are remarkably responsive. Give them the right environment, and they will respond. I would love to know which of these 5 you are going to try first. Tell me in the comments. I read them. And if this video helped you or someone you love, please share it. There are people in your life right now who need exactly this information and have no idea it exists. And if you have not subscribed yet, please do. Every week I bring you honest, evidence-based information that I wish every one of my patients had access to long before they needed surgery. Take care of your heart. It has been working for you every single minute of your life without asking for anything in return. It deserves this. One last thing, and this is important. Everything I have shared today is general information based on current research and my clinical experience. It is not a replacement for your personal medical care. Please do not stop or reduce any medication your doctor has prescribed without speaking to them first. Bring this information to your next appointment. Have the conversation. Your doctor is your partner in this. And these 5 strategies work best when they work alongside proper medical supervision.